Oxycontin addiction. Oxycontin is an opioid. Some illegal opioids, including heroin, cocaine, illegal non-opioid drugs such as marijuana, methadone. Marijuana may be legal for medical treatment in some states. Some prescription opioids, including Oxycontin or Oxycodone, fentanyl, hydrocodone, codeine, morphine, methadone, and non-opioid methamphetamine stimulant. What is the Oxycontin used for? Oxycontin is the brand name for the oxycodone. It is extended relief, so it can last for 12 hours. It's used to treat a severe pain. How it works? The Oxycontin might block the pain by binding to the opioid receptors on nerve cells. So what is the pain? The pain is just a symptom. It's not a disease. A disease may be an arthritis. For example, arthritis is a disease that may cause a pain symptom, such as pain. You may have a severe pain after a surgery or a major injury. You should use non-opioid medication, Tylenol, Motrin, research soma before an opioid. Or you should use low-dose opioid as possible to avoid major addiction from a high dose or overdose of the opioid. Drug abuse, it can be from the doctors who inappropriately prescribe. Manufacturers may be responsible for drug abuse if they fail to manage their distribution appropriately. Opioid abuse may lead to addiction, dependence. It can be physical or psychological. Addiction means you want to have the same feeling the opioid give you. Opioid effect or the Oxycontin effect, they give you a good feeling, a high, so to continue having that feeling. It means addiction. It's easy to get overdose because you want to feel better and better with that feeling. At least the same or better feeling. So you want to have, so it's easy to get overdose. When people get overdose, they can be death, addiction, or dependence may cause crimes due to drug dependence, drug addiction. They may not control themselves because of psychological issues. You should seek a medical treatment if you think you have drug or opioid dependence or addiction. To monitor and to decrease the drug addiction, some states have prescription drug monitoring programs to monitor the prescribers, the providers or doctors who prescribe opioid medications. So the best thing to avoid Oxycontin addiction, you should take Oxycontin when it's indicated, such as for severe pain after a surgery or major injury. You should stop the medication as instructed by your doctor. You may check to make sure you don't have this side effect. You may use non-opioid pain relief medication, Tylenol, Motrin, when you have a pain symptom instead of the opioid. If you have any further question, please let me know in the comment box below. Thank you. Heroin addiction. Addiction means you want to have the same feeling the opioid give you. Opioid effect, they give you a good feeling like high, so you continue having that feeling. It means addiction. Heroin is an illegal opioid, such as cocaine. Other non-opioid drugs, such as marijuana, methaqualone. Marijuana might be legal in some states for medical treatment. And prescription opioids, including Oxycontin or Oxycodone, fentanyl. Methamphetamine is non-opioid. It is stimulant. A lot of people start using heroin after they have hard time to get the Oxycontin due to the Oxycontin issue lawsuits to the manufacturer, Voodoo Pharma. A lot of people will die because of the Oxycontin long extended relief effects overdose. The manufacturers had to file a bankruptcy, and now it renamed as Nora Pharma. So when the Oxycontin supply has problems, the drug cartels take some advantage about that. They start produce the illegal drug, the heroin. The people who have the Oxycontin abuse, addiction, dependence, they are looking for a alternate drugs. They are start using heroin. They are start using heroin because this illegal drug is cheaper, but it's equivalent or stronger effects. Heroin dependence or addiction can be physical or psychological. People who have heroin addiction or dependence tend to be overdosed because they want to have the same feeling. In order to get the same feeling, they need to continue to use this drug. When they don't have money to buy the drug, they will commit crimes. You should seek a medical treatment if you think you have drug or opioid dependence or addiction. Fentanyl addiction. Fentanyl is the hot topic right now because many illegal migrants enter with the fentanyl products. So fentanyl is an opioid drug. We have illegal opioids and prescription opioids. Illegal opioids including heroin or cocaine. Non-opioid illegal drugs such as marijuana, methaqualone. Marijuana may be legal in some states. And the prescription opioids, including Oxycontin or oxycodone, fentanyl. Fentanyl is a synthetic opioid, and non-opioid methamphetamine. Methamphetamine is a stimulant. The prescription opioids, including Oxycontin, fentanyl, due to treat a severe pain. How it works: fentanyl might block the pain by binding to the opioid receptors on nerve cells. So what is the pain? The pain is just a symptom. It's not a disease. For example, arthritis is a disease that might cause a pain symptom. You may have a severe pain after a surgery or a major injury. You should use non-opioid medication, Tylenol, Motrin, research Soma before an opioid or low-dose opioid as possible to avoid major addiction from a high dose or overdose of the opioid. Fentanyl is being manufactured a lot nowadays from China, and then it gets into the United States via the Mexico border. People who have the heroin or Oxycontin addiction or dependence, they start using fentanyl. Maybe more convenient, and it might be cheaper or stronger effects. The Oxycontin supply had some issue because there are ongoing lawsuits to its manufacturer, Purdue Pharma. The Purdue Pharma had to file a bankruptcy. Prescription dose for medical treatment, the fentanyl batches from 25 to 100 microgram per hour. Fentanyl 25 to 100 microgram per hour equal to Oxycontin 10 milligram every 12 hours. Fentanyl is 50 times more potent than heroin and 100 times more potent than morphine per DEA. So per DEA, the lethal dose is about 2 milligram or 2,000 microgram. Many tablets or pills from these illegal migrants found more than 2 milligram. So one tablet contains more than 2 milligram. It's enough to kill a person who took that tablet or pill. The fentanyl dependence or addictions can be physical or psychological. Addiction means you want to have the same feeling the opioid give you. Opioid effect, they give you a good feeling like high, so to continue having that feeling. It means addiction. It's easy to get overdose because you want to feel better and better with that feeling. At least the same or better feeling. So you want to have, so it's easy to get overdose. When people get overdose, they can be death, addiction, or dependence may cause crimes due to drug dependence, drug addiction. They may not control themselves because of psychological issues. So people who have addiction or dependence to fentanyl really need medical treatment. You should seek a medical treatment if you think you have drug or opioid dependence or addiction. Fentanyl addiction can be very dangerous. If you have any further questions, please let me know in the comment box below. Thank you. Oxycontin addiction. Oxycontin is an opioid. Some illegal opioids, including heroin, cocaine, illegal non-opioid drugs such as marijuana, methadone. Marijuana may be legal